Welcome to the News USA YouTube channel. Nurse Elizabeth Johnson administers a COVID-19 vaccine to Melissa Mendez in Reading, Pennsylvania. Ben Hasty /Media News Group /Reading Eagle /Getty Images. A second shot of Johnson & Johnson's single-dose vaccine boosted antibodies in a lab study. The company said a booster shot could be given 8 months after the original vaccine. J&J will now submit the data to the U.S. Food and Drug Administration, it said. See more stories on Insider's business page. A second dose of Johnson & Johnson's COVID-19 vaccine boosted antibody levels in a small lab study. J&J said in a press release on Wednesday that after the booster shot, antibody levels were 9 times higher than after the original single-dose vaccine. Matti Mammon, the global R&D head for J&J subsidiary Janssen, said in a statement the company planned to meet with officials to discuss the possibility of a booster at least 8 months after the first dose. The company didn't specify how many people were in the study or how long after the first dose it gave the booster shot. The study hasn't yet been scrutinized by other experts in a peer review. J&J data comes as U.S. readies booster campaign rollout. The announcement comes as the U.S. prepares to roll out COVID-19 booster shots starting September 20 to help protect against the Delta variant, which has mutations that help it partially avoid the vaccine's protection. U.S. health officials excluded J&J vaccine recipients from the initial booster plans, saying they were waiting for additional data on a J&J booster shot. All the COVID-19 vaccines are still highly effective at preventing hospitalizations and deaths, U.S. health officials said, but offering boosters shots 8 months after initial vaccination would help stay ahead of the virus. In the U.S., people who have weakened immune systems can already get an extra dose of a coronavirus vaccine. The broader booster shot plan is still controversial. Some virologists and vaccine experts have said the extra shots aren't yet needed. Global health advocates, including leaders of the World Health Organization, have criticized the plan given the lack of access to first doses for many low- and middle-income countries. Story continues. The booster rollout also needs to clear the Food and Drug Administration and the Centers for Disease Control and Prevention. Both agencies have independent advisory groups composed of experts that typically debate and vote on decisions. Boosters shots have not been opted by the FDA. The need for a J&J booster shot is still unclear. About 14 million Americans have received J&J's shot, according to the CDC. In the J&J study, participants over 65 years old were given a lower dose, J&J said. There was a significant increase in the antibody response in this group, as well as in people aged 18 to 55, it said. It didn't mention people aged 55 to 65. Previous data from a small lab study that looked at the original single-shot vaccine showed antibodies against the Delta variant lasted at least 8 months. J&J released those results in early July. Dr. Dan Barouch, a virologist at Beth Israel Deaconess Medical Center in Boston, who was not involved in the booster trial but was involved in the July study, told the New York Times that it was too early to guesstimate real-world protection from J&J's latest study. But he was quite certain that officials, including at the White House, will use these data to likely justify or recommend a booster for J&J vaccinated people, probably with a second shot of J&J, per CNN. Read the original article on Business Insider, subscribe to the channel, like and share this video.